Yeah. Today is week 6 already, and we will talk about the nursing career critical thinking. Okay. And this is Pixel Bay. Okay, the source. These are very good pictures right here. Pixel Bay is a very good website for. You don't have to worry about the IP law. Okay, intellectual property law. If you took pictures from Pixel Bay. Okay. Let's look at the critical thinking in nursing career. Okay, building skills for better care. Okay. First question: why the CT? Okay, critical thinking matters in nursing. Nursing involves a complex, fast-paced decision making. So critical thinking improves the patient outcomes, safety, and the care quality. So remember, this is a good answer, okay, for this one. It's the ability to analyze, evaluate, and apply reasoning to solve problems. That's a good answer for answering the critical thinking is matters in nursing or not, okay? A nurse deciding whether a patient's symptoms, okay, indicate an allergic reaction or an infection, okay? So number one, let's look at what is the critical thinking in nursing, okay? Number two, why it's essential for career success. It's always a question mark, okay? How to develop and apply in practice. Real examples and scenarios, okay? So let's understanding the critical thinking for nursing first, okay? That involves observation, analysis, interpretation, and decision making. And it's different from routine task performance because it requires reasoning and judgment, okay? Based on the evidence, not assumption, okay? For example, using the patient data, not just the intuition, okay? Observation, analysis, and decision. 3 steps, okay? OAD, okay? Observation, analysis, and decision. Okay, so the core components of CT, we can break it down, okay? First is observation, okay? So you can noticing subtle changes, okay? Like a patient's breathing pattern. Analysis, connecting the symptoms to possible causes, okay? Evaluation, you are weighing options. Call a doctor now or monitor, okay? Call a doctor now or monitor, okay? Monitor, okay? Monitor normally have a blood pressure, okay? And, the machine, okay? Problem solving, choosing and implementing a solution, okay? And reflection and learning from outcomes to improve future decisions. So let's say a good doctor, good doctor have a lot of experiences, care patients, and care a lot of patients, right? That's why he become a good doctors, okay? So when in a medical school, they have called big body teacher. The big body is dead body, so they have make a, in Chinese they say 解剖, okay, like cut the body out and to to understand the sickness, okay? And let's look at the impact on nursing practice, okay? And you have to aware the patient safety, okay? Prevents errors and catching a medication mismatch, for example, okay? Efficiency, okay? You have to prioritize texts in higher pressure settings. Actually, in the hospital, there are high pressure settings, okay? And advocacy, okay, helps the nurses to speak up for patients' needs. And the career growth, employers value problem solvers, okay? And the studies show critical thinking reduce hospital errors by up to 30%, okay? By up to 30%. Critical thinking is very important. So use the word like essential, okay? Essential. Remember pronouns essential, okay? And developing the critical thinking skills, I will answer how to build this skill, okay? Also, this is from Pixel Bay, okay? Ask questions. Why is this happening? What else could it be, okay? Practice scenarios, use simulations or case studies, okay? And seek feedback, learn from the mentors or peers, okay? So when you maybe you go to a hospital, you have some more experienced nurses than you, right? They will be your mentors, okay, or peers. And stay curious, okay, like research conditions, treatments, and protocols, okay. Reflect. After shifts, okay, shifts means you change your working hours, okay? Shifts. Think what went well, what could I improve, okay? Keep a journal to track decision-making process, okay? For the applying critical thinking, this is a scenario one here. And this is a real-world example about the chest pain, okay? Chest pain. And this is a source right here, okay? And the story is started from here. Patient reports the chest pain, okay? Vitals are stable, but they are anxious, okay? And nurse observes pain started after eating, no shortness of breath, okay? So the critical thinking steps, number one, analyze. Could be a cardiac, GI, or anxiety related, okay? Analyze right here. Second step, evaluate. Order the EGG, but also ask about diet, like spicy food, okay? Is the patient eat the spicy food or not, okay? Decide, monitor, report to doctor with the findings, okay? Outcomes. So the scenario one turns out to be acid reflux, okay? Not a heart attack, okay? Quick thinking saves time. Quick thinking saves time. And second scenario is a medication error, okay? That's a real-world example. For example, the nurse notices the patient's dose, okay, seems higher compared to their chart, okay? So you use observation, so double check order and patient history, okay? Analyze possible typo or wrong patient, okay? Contact the pharmacy or doctor to confirm, to evaluate, okay? So the outcome may be prevents the overdose. So also the critical thinking CT saves a life, okay? Saves a life. So, what's the challenges to critical thinking? That's the obstacles you need to overcoming. Okay, overcoming. Like a time pressure. Okay, emergency settings limit the reflection time. Okay. Second one, fatigue. Okay, long shifters down focus, downs make a silly. Okay, make a like a stupid. Okay, or down focus. So self-care is the key. Okay, self-care is the key. Bias, assuming it's always X, can lead to a mistake. Okay, bias, assuming something is always X. Okay, X means something. Okay, can lead to mistakes. Solution: practice mindfulness and double checking habits. Okay. That's a conclusion. That's a takeaways. Okay. Critical thinking is a learnable, essential skill for nurses. It improves patient care and boosts your career. Okay. And start small. Okay. Small question, reflect, and practice daily. Okay. Call to action. Next step, pick one situation to analyze critically. Okay. Okay.